You're diagnosed with obstructive sleep apnea. What do you do about it? Well, many people have heard of CPAP therapy. CPAP therapy are different masks that you put on your face, and it's connected to a machine that's simply blowing air into your airway. That's the gold standard, that's the best treatment, and it's really the treatment you really should initiate if you have at least moderate or severe sleep apnea. Some people with more mild sleep apnea can get away with other treatments if they so choose. It depends on the person. I personally recommend anyone that has significant sleep apnea first try CPAP therapy. If they don't succeed with CPAP therapy, then we can try other alternative treatments. So if you're really reserved and really don't want to be treated with a CPAP device, there definitely is another option for those with mild or moderately severe obstructive sleep apnea. You can get a device called an oral mandibular advancement device. What this is it's a simple dental device that gets molded to your upper and lower teeth, and it can adjust. It can actually slide your lower jaw forward. By simply sliding it forward, it slides that jaw forward, and your tongue is attached to that, and by sliding the tongue forward, it opens the back of your airway and you can breathe better. So you can either get this customized through a dentist if you have sleep apnea diagnosed with a sleep test, or you can just get an over-the-counter device. You can Google it and get one. They're not quite as sophisticated, they tend to break down, but they definitely can help for more mild sleep apnea. And patients with really bad snoring can respond to that as well. Other things other than CPAP therapy are, because it's highly associated with obesity, a good weight loss program with significant weight loss could be very helpful. People who sleep on their back tend to have worsened sleep apnea, so there's a certain population that if they sleep on their side, they don't have sleep apnea. So you can try techniques to avoid sleeping on your side, on your back. We do have ways of helping that we could talk about. Other options, there's a newer intervention that some people benefit from. It's a select population, but there's a newer technique you may have heard of. It's called the Inspire. What the Inspire is it's a surgical implantable device that's a nerve stimulator. We've actually been doing nerve stimulation in the world of neurology for decades, but over the last 5 years, there's this technique where it's an implantable stimulator. It gets implanted in your chest, and there's a wire that goes up to the back of your tongue, and it stimulates your tongue nerve. By stimulating the tongue nerve, it activates those tongue muscles, pushing your tongue forward, preventing that from blocking the airway. You only turn that on when you're sleeping at night. So that's definitely an option for those of you who really don't want to do the CPAP therapy. In my experience, though, most of my patients would prefer to be treated with the CPAP.